we'll record the webinar. We'll make it available to everyone as well who wasn't able to join today. And certainly appreciate everyone's time. Appreciate Brian Villavecchia from Villavecchia Buying Group setting up this presentation. And Ed McCarthy, private practice optician in Massachusetts. I'm sure most of you know. Infamous from Opticians on Facebook. And certainly appreciate you joining. So we're just going to have an open style kind of conversation today. I'll give a quick overview in terms of how the system essentially works. And for anyone who isn't familiar, can certainly visit our website at 42020now.com, and we have videos and some walkthroughs in terms of how the system works. But essentially what we're doing is an eye exam in an office without a doctor present. So an on-site technician will do all the normal pre-testing on the normal diagnostic devices, non-contact, pressure check, ARK, which is an autorefractor if you don't have one already, lensometry for a patient with an existing prescription. At that point, we'll do retinal photos. We'll do some chair skills as well, which we spend 5 days on site training a staff to do all this. And we then put the patient into the exam chair. At that point, a remote technician will come on the screen. One of our technicians, they're all COTs or COMTs, average 10-year experience coming out of kind of ophthalmology settings like teaching institutions where they did a lot of refractions. They come on screen, they do the remote refraction, controlling the digital phoropter remotely. And then at that point, a doctor will come on screen, have a clinical consult, discuss any questions with the patients, and then finalize a prescription for the patient that you get within a couple minutes of the exam completion, so you can complete the optical sale that day. So that's essentially just a quick 30,000-foot overview of what we're doing. It's a comprehensive exam that's billable to most insurance plans. If you contract with insurance, you can bill for exams, or primarily a large portion of our business is primarily in the self-pay market. So certainly appreciate any questions you have. You can enter them into the chat. And with that, I'm going to turn it over to Ed, who's just going to kind of give you a brief rundown in terms of his experience, and then we can kind of open it up for Q&A. Any questions?
I'm sorry, I have a lot of background noise, so I muted myself and I couldn't unmute it. Oh, good morning, everybody. I don't know how many people are here, but boils down to, I got into this a year and a half ago, a little more than that, because I had an OD retire. I had the practice there for over 20 years. Couldn't find an OD to save my life. One OD did show a little mild interest, but couldn't find anybody. So I talked to Brian on a pretty regular basis. He's the one to introduce me to 2020 Now. I did a little bit of research, and I'm very lucky to have it. So I have 3 stores, and I own one that I'm sitting in right now is in Acton, Mass. And I've had an OD with me for 33 years, fully booked all the time. The other store is in Townsend. I've owned that since '99, and the optometrist that was there has been with me, but like I said, she retired. And I have a 3rd store with my son in Westford, and he has a part-time OD, and I like to use it as an example often. Here in Acton, if somebody calls and they want to book an appointment, we just ask them what day. In Westford, when you have a part-time OD, they typically goes like this: what day would you like to come in? The doctor's in on Tuesdays, Thursdays, and one Saturday a month. And oftentimes you get the response of, well, I'll call you back. They have to see if that fits their schedule. The beauty with 2020 Now was that we are like we are here in Acton. What day would you like to come in? We just eliminate that, whether it will fit your schedule or not. The thing that surprised me, there's a few things that surprised me about this system. One, I never did any teching, none. I've been working in the optical industry since 1978, never did any teching whatsoever. And I'll be honest, teaching an old dog new tricks, I was intimidated. And the first day that the trainers came in, I was calling a couple of friends of mine going, it can't be this easy. It just can't be. And they walked us through a few days of training, and by the end, we were kind of surprised, me and one of my employees, at how simple the system is. So the other takeaway that I got from this is because it's different, because the doctor comes in via a Zoom call, and because one of the techs come in via a Zoom call. People think that this is really a ultra modern kind of system, and they're blown away by it. The word of mouth, people going right out of the exam room and booking their spouse. We're now a little more than a year and a half. The recall was tremendous, far better than the other two stores. People just like this kind of new modern tech. And like I said, it's been very simple. I would have to have closed the store if I hadn't found an OD. It's not, the store can't sustain itself without exams. And it's been fantastic. And honestly, I wished I was aware of it. I don't even know if it existed years earlier, because the doctor was whittling her time down, and it started to hurt the store. It started to hurt the volume.
Yeah, that's great, Ed. You know, I was going to ask, maybe you could discuss a little bit about the training in terms of, you know, maybe some steps in terms of what you did. I think by the last day of training, you were probably doing some live exams as well.
Well, as it turns out, so we were training Monday through Friday, and so we expected to go on Thursday. We were seeing my wife, we were seeing my kids, and Brendan was seeing people that some of you were familiar with, just to kind of get your cadence down, try to get some familiar, try to be a little less all thumbs. And the woman who was training us ended up with car trouble and couldn't come on Friday, and we had a full slate. So I turned, the guy that works for me is Brendan, and I said, well, what difference does it make? Friday versus Monday, we go live on our own Monday anyhow, and let's just not let the people know we're new at this. Let them assume that we've been doing this longer than we have been. And it worked flawlessly. She did train us very, very well. She took it from start to finish. Now back up a little bit. When I was going to do this, I went soup to nuts. I did everything. I replaced everything in the lane, and right down to the chair and stand. Sorry, I don't have to answer that, but it's making a lot of noise.
No, that's okay. It's live TV. It's all good. So, you know, in terms of the training, it's, you know, it is 5 days. You know, it's on site. We come, fly in that that first half day on Monday, and then fly out half day on Friday. So the morning session usually is just to oversee you doing those live exams. Like you said, that Thursday kind of is a friends and family, where the trainer's there to oversee and assist with those first real live run through exams. But after 3 days really of on-site full training, you're up and running. So maybe a little bit about the business component. I know a lot of people have a lot of questions about the business side, and we have people just joining in just now. So if you just joined, you can drop a question in the chat. We just kind of did a walkthrough in terms of what's involved in terms of the complete exam process. So if anyone has any questions, feel free to ask them in the chat. We can bring you on to have a discussion with Ed. There's depending on where people are joining from all over the country, there's 50 different state laws, regulations, optometry board rules, medical board rules. So there's a lot of individualized conversations that kind of have to take place. But particularly for you, Ed, maybe if you're comfortable discussing a little bit about the business model you're deploying, where we're charging you per exam, and kind of you're doing something a little bit different, but you want to kind of share a little bit about how like the business side of how you're running the exams in your business.
Well, my goal is to eliminate insurances, and I think this is a first step towards it. I have complete control over the dispensary and the lane. So I can do whatever I want outside of the insurance realm. I'm not going to be dictated by them, because I'm not partnering with them. And that's my goal for my other stores as well. And I'm using this as a stepping stone to see if it's capable of just going without insurances, because they're still here. We have an insurance. They're going to pay me a whopping $48 for a pair of glasses. How is that going to work? The frame costs, I mean, we're at break even on some of these insurances. If we can eliminate them, and we can do, if we're married to the doctors, and they're dictating what insurances they're going to take, that's going to dictate what insurances you're going to take in the dispensary. And I'm kind of doing an end around on that.
No, it's great. Yeah, so you're doing more of a self-pay model. Do you are you charging patients per exam? Or are you bundling it into your exam fee, or into
For the most part, we're bundling.
You're doing a
And
bundle?
so this is how you get private pay, and this is how you get people away from, in Massachusetts, it's called Mass Health, the Medicaid system. People will go and they'll say, I want a free exam. It kind of is. We bundle it with the glasses. And you get to choose from this selection versus the Medicaid selection. That has been working pretty well for me so far, and it's getting people in the door who wouldn't have been, because I am not contracted with Mass Health. I put it out there on Facebook a couple of weeks ago. What's it like to accept Mass Health? And I got an overwhelming don't do it. It's among the worst. It's as bad as Spectera or anything else. You're not going to profit from it. You're going to run all day long answering phones from people who you're just not going to make any money off of. And so that's one of the reasons why I'm doing this bundling. And so far, we've only been doing it since pretty much Christmas, little after Christmas, and it's been working really well.
Okay. Yeah, I mean, there's, we have customers that range from doing a bundle like you're doing to, one of my customers charges as much as $175 for the exam in a high-end optical boutique. So it really depends on the market, depends on the, the demand in the market and the marketplace. I'd say on average, most of our customers are charging around $95 for the exam. And I like that better than a bundle, just in so much that if the patient were to, cancel their order, you're not out the exam fee that we're then going to bill you for the exam fee. So I do like, collecting that exam fee separately. And then that way, if you want to do something like a styling credit, where, if you purchase X amount today, we'll offset the cost by Y, which covers the exam cost. That way, if they cancel the optical sale after the fact, you still collected the exam fee with some margin on that for your administrative costs, which by law you're supposed to do. You're supposed to cover your cost of your technician, your space, and then the equipment. So you're allowed to charge an administrative fee on top of the clinical fee that you're essentially collecting on our behalf. So there's a lot of different ways that you can implement the system. And so what Ed's doing is very successful, bundling in his market, and then others may be doing a self-pay model as well.
I call it a bundle, but the way we phrase it to people is we deduct the cost of the exam from the eyeglasses.
There you go. Okay, I got you. So you're charging.
We're staying legal, and then if they walk, we're still getting our fee for the exam itself.
Gotcha. So you're doing essentially a styling credit in the full amount of the exam to offset it as a bundle. Yeah, which is, I think, actually a great way to do it, actually. If you want to charge. And then some of my customers who started out that way actually decided to stop doing that altogether and are just collecting like a full exam fee, and like charging anywhere between 95 to 125 is pretty common for this service offering.
Thanks again for putting this together, Ed. As always, I appreciate you taking the time. Anybody that's not a member of the group, just so that you are aware, Bob and 2020 Now have put together a nice little program for us, for our members, that you get a savings on your per exam fees, as well as some of the equipment charges and other things like that. But Bob, you can go into more details when you speak with people on it.
Yeah, for sure. Yeah, if anyone's not already a member of Villavecchia Group, I think it's by far one of the strongest discounts available on the market. And I know when I see people ask questions on what group should they join, Villavecchia always has a lot of comments from your members on opticians on Facebook. So certainly a lot of people spreading the word about what you've put together there. And yeah, so certainly happy to discuss equipment. If people have any questions about the equipment, Ed could share what he did. Ed kind of did a hybrid thing where he wanted a really fancy chair and stand, so he got like the top of the line chair and stand for his office. And we supplemented it with some of the diagnostic equipment that he would need. We are a tier 3 distributor for a number of groups. So whether it's, TopCon equipment or Visionics, Centerview eye care cameras, and the tonometry testing. So lots of different companies that we're integrated with like 18 different OEMs. So sometimes people have existing equipment. If they had a doctor in the lane before, they might already have a camera. Cameras are usually pretty easy to integrate. That's just essentially a picture that's uploaded. So that's a high ticket item. Two of the items that are most common that most people don't have is about, is a digital phoropter and a digital slit lamp. So those are kind of the two items most people haven't upgraded to, even doctor groups. So that's usually kind of the cost there, and then our software and our hardware. So we can always do a custom build out. It looks like Pam has a question. Hold on a second, Pam. Let me bring you on screen here.
Hey, hi. Okay, so I have a quick question. We have been from the get-go, well, right around Christmas time, we started doing what Ed is doing also, where we credit back the cost of the exam against the eyewear. That way, in the end, it's free, so that we could bring in some of the people who might walk away because we don't take insurance. My question is that we're charging a flat fee for comprehensive eye exam with retinal imaging, and then another piece, another price with contacts. Do I have to have two line items within that? One, the cost of the exam, and then an administrative fee, or can I just leave it all together? Because the insurance companies, when they submit for reimbursement, if it says administrative fees, they may not approve that.
Yeah, no, if you're billing insurance directly,
I'm not.
Oh yeah, you're not. So I mean, just generally speaking, for everyone, you would essentially just be billing for two of the most common codes, which is like it's a 92004 or 92014, which is a new exam, or it's a comprehensive exam, or returning a new exam or a returning exam. And so that's kind of just the two most common codes we bill for. And that you're going to only get, if you're contracted with IMED, doesn't matter what you charge for your comprehensive exam, they're going to give you your contracted rate, which is like $47. So that's all you're really going to be able to do with the insurance plans. They're just going to pay you the contract amount. So no, you wouldn't break out the administrative fee. Where we talk about the administrative fee, what we're saying is essentially the way the contracts are written. And it depends on the state that you're in, of course, too. There's only 13 states in the country that have corporate practice of optometry laws where you're essentially allowed to hire an OD and bill for exams. And then in the rest of the country, the way that we're essentially doing this, what we're doing is reassigning our benefits to you, where you're collecting the fee on our behalf. And this is in the contract. And then there's a couple states, California, Texas, Virginia, where there's no other model except where we must sublease the space as a separate entity and we collect the exam fee directly. So there's some different rules and regulations across different states. But in your state, what you're essentially doing is you're collecting the exam fee on our behalf, whether you bill an insurance company or you're charging a self-pay, you're collecting the exam fee on our behalf. And legally, what the laws actually say is that you're supposed to charge an administrative fee. If you essentially actually just collected exactly the same amount that we were charging you, in essence, you're actually kind of giving away something that you're not supposed to be giving away, which is your time, your space, and your staff costs. So you're actually supposed to charge an administrative fee, which is not defined in the law at all. It just kind of has to pass a legal sniff test, which at the end of the month, how much did you collect can you justify with your cost of your space, the equipment, and your staff, which is thousands of dollars a month, really. It's just that if you were collecting, say, $20,000 a month on exam fees and we were only charging you $2,000 a month, it really wouldn't look right and you wouldn't pass that test. So what you're doing, I think, is great. So I don't think you shouldn't be adding in a separate line item for that administrative. It's just a legal thing on the back end that justifies the difference between what you're collecting on our behalf and what you retain.
Yeah, we're collecting the fee that we're charged plus an hour labor, so it's pretty minimal. I just didn't know if legally it had to show two different things on the invoice to the customer, because I just didn't want to have to explain it away
No.
Oh, this is, okay, great, perfect.
Nope. Yep. No, I think you're doing great. And the space looks great. I haven't seen the space since we did our first Zoom calls before you were open. So it looks great.
There's my sign.
Yeah. Congratulations.
Thanks.
All right. So we're going to appreciate you joining in, Pam. We're going to bring Brian on. Brian had a question. Give me a second to find you in the list here, Brian.
Drew.
Drew. Oh, there you go. Hey, oh, yeah, Brian is actually acting as my co-host, keeping me straight here. There we go. Hold on a second. All right, Drew, I'm asking to unmute you. Hey, Drew, how
All
you
right,
doing?
can you hear me?
Yep.
I'm good, thank you. I just have a couple of questions. I'm a professional recruiter, and I have Kansas in my territory, so I have like 3 questions. I also own a few practices. One is recently we've been in contact with the state of Kansas and also Medicaid and Medicare. We are finding out that Medicare and Medicaid has approved tele-optometry in the state of Kansas, but it's the board that does not have, that has an issue with it, I should say. Now, I think I've talked to you guys about this before, but a question that's arisen by one of our doctors is, can we like install a telemedicine lane in a second door and have like maybe pay you guys to hire a tech for that office so that we could do eye exams and it'd still technically be within legal reasons for 2-door state laws?
Yeah. I mean, the question really, and Drew, I think we've spoken in the past too, a couple times about Kansas. I have to go back and see if there were any updates. So again, this is where we get kind of in the weeds real quick, from state to state, where some
Yep.
states just have really restrictive laws, which is like a direct supervision law in Kansas. I think
Yep.
that's if memory serves me correctly, that was the thing where like you would have to have, so for example, if you are saying you have a doctor on site and you're looking
Yes.
to do it for overflow capacity, you
Yes.
essentially are meeting the direct supervision ruling then, where direct supervision, these laws are generally poorly worded, but essentially direct supervision means on site, in person. It's like,
For medical,
yeah,
for medical coding, recent
it's well,
99 codes.
yeah, well, I it's more from like the way the laws and the boards are written. So again, if it's a board rule, it's one thing, because we're also an ophthalmology PC. So an optometry
Correct.
board rule doesn't necessarily apply to optometrists that work for or are delegated authority by an ophthalmology group. So we have some legal protection there, depending again on how the laws are written, depending on the states. Like in Texas, they actually went to the courts in Texas, and Texas upheld the ruling. So essentially, we're operating on precedents that most courts would look to that Texas ruling that said essentially optometrists that work for an ophthalmology group are governed by essentially that can be delegated authority by the ophthalmology group. So essentially, our optometrists operate under like delegated authority from medical board rules, but they are still licensed by the state optometry boards. So, we'd like to try to be a good corporate citizen, and we'd like to try to meet those things. So getting back to your specific situation, if memory serves me correctly, Kansas has the direct supervision requirement, which was the kind of the pin that was holding us back from providing services for you in Kansas as a separate entity. But if you have a doctor on location and you're so busy that you need an extra teleoptometry lane, which a few of our customers do have, then you would be meeting the direct supervision requirement, and therefore we could probably provide teleoptometry services there. I would just have to go back and double check that.
Well, then I'm going to go to my boss and I'm going to tell her that, because she's an ophthalmologist that's in charge of all our stuff. I'm going to, sorry, I got a call come in, but anyway, we have 11 doctors to take the overflow because we have 2 lanes in each one of these corporate locations that the doctor actually holds the lease and just pays rent to the corporation. So therefore, what we're trying to do is find a corporate partner per se to have options for the doctor to supply that overflow coverage. And we have, our legal department said that it's basically like exactly what you just said, because it is a.
I think we lost Drew there for a second.
This would actually be there. Can you guys hear me?
Yeah, you just came back.
Okay. Well, basically the direct supervision would be fine because the optometrists that work for us would be able to perform all the gonioscopy and all that stuff.
Yeah, it's again, we're not even doing agonio as part of the exam. And so again, it's really just meeting that requirement from the state board. And again, if memory serves me correctly, it actually was a House bill rule. So see, there's a very
Exactly.
important difference between optometry board regulations and House state laws and legislation. So when something is actually in a House state law, that's something, and if it also equally applies to physicians and optometrists, usually the most limiting language in laws are targeting optometrists and are basically saying what they can't do. And then the laws essentially usually say, but physicians can, or they don't mention physicians at all. So it's just assumed MDs can do whatever they want to, essentially, if they're not specifically excluded. There's a couple states in the country, California and Kansas, for example, that have like specific language regarding physicians. And so that's then where, as an ophthalmology group, we have to obviously abide by that legally because it's in a House state law. So again, I'll go back and review that, Drew, and get back in touch with you. But I think as long as you have an on-site doctor, essentially they're meeting the legal requirement for the direct supervision of an on-site technician. And by the way, if memory serves me correctly, it was data gathering on even like an autorefractor, which is really limiting. They're basically trying to block people from doing tele-optometry in Kansas, essentially, with that law, where they're saying like a technician can't even use an autorefractor without a doctor being on site. So that's kind of how
Right.
stifling that Kansas City law was, if memory serves me correctly. But
Yeah,
I'll go
no,
back
the
and-
Kansas, yeah,
I'll go back and check
Kansas
it.
law is correct. Go ahead. I'm so sorry.
No, I'll go back and check that and get back to you. If you have a doctor on site, I think that we could proceed, but I'll have to just check that with my legal team as well.
Okay. And then the only other question I do have is, I don't remember if you had answered this. So the practice that I currently own in Omaha, we have Zeiss telemedicine equipment, like we have a 4-opter and stuff like that. Is that some of our equipment, is it interchangeable with your equipment and the Optos and that stuff?
Yeah, no, it's a great question. So like we're integrated with Optos, for example. Zeiss, unfortunately, wasn't willing to do any integrations with us. So they, on the digital phoropters, we just aren't able to control their digital phoropter remotely. We are
That
integrated with
sucks.
like 6 different digital phoropter systems, whether it's like the Marco systems, Visionics. So there's a couple Marco systems we're integrated with, a couple Visionics systems. Topcon has one device that I actually like the Topcon kind of the best at this point, because it's just kind of, in my 3 years of experience, it's proven out to be the most reliable. Like I literally never get a call. In 3 years, I've had one call about a digital phoropter from Topcon having an issue. So I
Okay.
like Topcon's digital phoropter the most personally. And I
Okay.
think that's kind of the one most of my customers at this point have purchased over the past year or so, because I kind of switched over to that as a primary source. But they are more expensive than some of the other brands, and so some places might choose for to save some money on different models. And sometimes there's some used equipment available where we can save some people some money, just depending on what the vendors, the manufacturers have in stock. Sometimes they have some refurbished equipment in stock. So
Right.
as a tier 3 distributor, we can usually save some people money. But what we really have to do is an individual price build for someone, where they send me all the individual make and models, and I'm pretty sure I did that for you previously, but we could revisit it. And
Yeah, I've updated a lot of my equipment since then. I mean, we're trying to eliminate as much cost as we can, because we still got some stuff we're working on to get back to good, I guess you would call it. But I mean, this is stuff that, in one of our practices, we have an 85-year-old doctor. So, I mean, it's only a matter of time. So yeah. So I do appreciate I think you still have my contact information. Just contact me offline and we can talk more.
yeah, no, it's great. I think it's great questions. Appreciate you jumping in, asking the questions. I think it's good for everyone to hear how, generally speaking, we do have to have individualized conversations by state to make sure how we're operating in each state's the right way. And then from there, we can kind of do a price build based off of what equipment you have. And so it really kind of is a very customized solution for each office. Some offices may have never done eye exams and have an empty room and they need everything. And some offices might have almost everything they need, but just need maybe to switch out like maybe a phoropter that was a manual phoropter that the doctor had, and a slit lamp, and they're pretty much ready to go. So the cost to set up could really vary anywhere between our setup fees with training, the computer equipment, the software, it's around $18,000. So like if you had everything you already needed, the out-of-pocket cost would be around $18,000 to get set up. If you needed a complete exam lane, you're around $95,000 for everything new. Or you could start saving some money from some places if you wanted, depending on your business model, if you wanted to get, like a refurbished cameras or some refurbished equipment, there's ways to kind of get that cost down to around $75,000 if you were willing to do some used or refurbished equipment. You didn't have anything down to the chairs and stands, you could probably get set up for around 75,000. So I don't, if anyone has any more questions, can feel free to raise your hands or ask questions in the chat, and bring you on. With that, I know everyone's really busy. It's midday. Appreciate everyone jumping on. Brian, obviously, always appreciate your support. And Ed, of course, I know you're busy. Your phone's ringing off the hook. So you're pretty good. Actually, you know what? We have a couple hands raised. Let me unmute Lewis, it looks like. Hold on a second, Lewis.
Hello, how are you?
Hey, Lewis, how you doing?
Doing okay. So how does this model work with like VSP and IMED? Can you build the examinations to VSP and IMED, or can you not?
Yeah, so it depends. So it's a really great question, and I'll kind of walk you through the iteration of where we started, and it depends on the business that you're in. So for example, we have some corporate partners where we actually sublease spaces where we are the independent IOD. And so if you were in a type of location where you had a history of exams, where you were doing a high volume of exams, that would be a separate conversation where we could talk about us subleasing a space, us staffing it, and us billing insurances. What we were doing before, and Ed actually was one of the test cases for this that made us change the way we were doing business, where we were subleasing spaces in certain states where opticians typically did not bill, and we would contract to bill. And we're contracted to bill for, like with IMED, on in 200 locations. But what happens most of the time is, let's say, for example, Ed was on a number of IMED plans, and they have like 14 different plans. And Ed, I'm speaking just off the cuff here. I don't know how many you were on, but let's just say Ed was contracted with like 6 of them or 8 of them or whatever it was. And we applied to get on IMED, and they actually just flat out turned us down in that location. They said, we're all good there, which Ed's doctor retired. They weren't all good. He needed the coverage, but we just, we couldn't get contracted at that location. So we can't control that. Let's say another location, we did get approved, but they put us on 2 or 3 plans that weren't even the same plans as what the Optical had. So what we decided to do was to stop offering that level of service where we would sublease and bill. We're not doing it anymore, unless we're literally like taking over like a Costco, a Walmart, a BJ's, or there are some private optical chains out there that we're providers for that have high volumes where we actually do staff them. So that's a one-off conversation based off of exam volumes. If it's applicable, it's probably not going to fit most people on this call. But we're talking 100 plus 200 exams a month, right? In order for us to staff it with a technician. So that's a separate kind of one-off conversation. The way that you would primarily do it is you're contracted to bill with IMED. You would contract to bill for the eye exam. So you would upgrade your service level to bill to be a full service exam location. You would actually bill, you're collecting the fee on our behalf. We're charging you at the end of the month per exam, and you're collecting that fee from the insurance company. So there's a mechanism in place for you to be able to do that, even in states in which you're typically not able to hire an optometrist and do that. So I guess it would depend, like, have you ever done it before? Questions that I usually ask,
we're paneled with IMED, and we have a contracted doctor who does eye exams for us. So
what state are you in?
Missouri.
Okay, and so you're able to hire a doctor. Oh, yeah, in Missouri, you're able to hire a doctor and bill for
Correct.
the exams. Yes,
yeah, he's a 1099 contract, but yeah, I hire him. He's
yeah,
not an employee, but
so you're in one of the 13 states in the country where you can actually practice corporate practice of optometry. You can essentially charge whatever you want for an exam fee. And, so you're in a different situation than a lot of other people, maybe on the call or just in the country in general. So in that instance, you're just going to add our doctors that are licensed in Missouri onto your panels. And we're operational in Missouri, and we have customers in Missouri. So,
same deal with VSP then.
So VSP is a separate situation where if you're not a doctor owned entity, you probably cannot, are you contracted with
I,
VSP? currently?
I'm contracted with VSP. Don't ask me how or why, but it happened, and so we're going to keep
So
it
you may be
for now.
grandfathered under a thing. So the short answer is you
There's a
may,
muscle involved, but I'll just leave
Yeah.
it at that.
no, I got you. Yeah, I think I have an idea. So if you're able to do that, again, it's a one-off situation. You could apply to contract with for the eye exams, but I can't guarantee that you would be added because it's such a one-off unique situation. We even though we can contract with VSP in network ourselves in our sublease locations, we actually don't do it. We bill it out of network because it actually pays more. So, it's just as easy to submit it out of network as it is in network, essentially through the clearinghouses. So, I'm just sharing with you what we do actually, because it pays more than 10% higher reimbursement.
Well, sure, and it's a very intriguing model for sure, especially being an independent optician that employs effectively a doctor. And so I'm just trying to wrap my head around it because I know some things have to change, but I don't know what that's going to look like. And so this seems like it might be the path of least resistance, to finding a new OD, because buying an OD, I can't afford to keep somebody on staff 6 days a week if that were open. It's crazy expensive, and we're not getting the exam volume.
Well, I'll defer to Ed to share with you. Ed, you want to share a little bit more about your experience there?
Well, it's exactly the situation I was in. We're not allowed to hire anybody in Massachusetts, not allowed to employ an OD. So we try to do these, get creative, so to speak. And even that didn't work. So, rent-free, that wasn't going to entice anybody. Nothing was working as far as getting somebody to go to this location. They wanted a guarantee of anywhere from $450 to $600 a day. And given what the insurances pay, we can't guarantee that.
Yeah, it's impossible.
We can't, even if we wanted to supplement it, we're not legally allowed to do that, but I know it's been done. Don't ask me who. But even at that, you couldn't do it. So now this was the end around that we've come up with that's worked beautifully for me for the past, since a year ago, September. I'm coming up on 2 years now, I guess, a year and a half. And but yeah, you can't get an OD. And when you do find them, they want a big amount of money guaranteed per day. And even if you were able to get somebody, that's a pretty lousy exam. If they're going to be sliding to make it break even, you need to see about 12, 14 people in an 8-hour day. If you're seeing 12, 14 people in an 8-hour day, that's a very fast exam. That's very rushed. This is very laid back. I do it I take my time, about an hour per is what I take for an exam.
So
I can do it quicker. I can do it quicker, but I choose not to.
No, you don't have a separate tech doing it. So you're doing it, or one of your opticians
I have a tech. I do it, and I'm going to be honest with you. I've been an optician, like I said, I've been in the field since 1978. I do it because I enjoy it. It's very different for me. I actually enjoy that new career, if you want to say. At 60 years old, I'm doing something very different from what I've always done. I could hire people. I do have somebody who does it 3 days a week. I do it 2 days a week.
Very cool. Okay. Yeah. So that's my big piece. Like, well, what's the VSP thing going to happen for us? Because we do bill for that. And so, it's 20% of my business, so I can't let that go. Not yet, at least.
Were you able to get your is your on-site doctor contracted to bill for the eye exams through, and that's going through your tax ID? So your tax ID was credentialed to bill through, or is it going through?
My tax ID is credentialed to bill through. Yeah, I'm a unicorn regarding VSP.
You should be able to add a doctor, so essentially we're going to give you a list of doctors that are operational licensed in your state. You're going to add them just as you would any other associate doctor. We're going to update the CAQH files on our side to make sure they match.
Okay.
All your location information, and you're just going to fill out the information sheet to get them credentialed, same as you normally would. So you are you're definitely in a unique situation. Let's chat offline, and we could but yeah, if your business is already credentialed, you're just adding essentially an associate doctor at your location.
That's kind of how I saw it, but all these giant entities just will find a way to stick it in you, you know?
Yeah,
So,
well, with the insurance thing, like I said, I mean, Liz, I originally made promises to Ed that we couldn't deliver on because you know, in the end, I had never had IMED turn us down at a location until Ed. And then
Sure.
we tried to credential at Ed's location on our side under our tax ID, and they just flat out denied us, which is not uncommon. Sometimes doctor owned, like sometimes doctors buy practices for like $1 million or more. And then they take over a practice and it turns out they can't get on any of the panels that all the existing patients were on. The value of that practice evaporates overnight. We've actually seen it happen to some of our customers. And then they're like, well, you know, might as well bring you in and do like a self-pay type of exam because I can't even get credentialed on these insurance plans as the doctor. So these insurance plans essentially are not your friends for the most part, you know, and they're, you know, we can't guarantee anything around it. All we can say is we can try at this point. I'm not promising anything. We can try.
Well-
You can add our doctors. You can see what they come back for, but it sounds like you're in a situation where you could do it.
so it seems that way. So then my next question, and of course, this might be getting too much into the weeds. So we pay 2020 now per examination, right? And then we figure out our fees and you just basically take that cut from our fees. Am I correct in understanding that?
We invoice you at the end of the month based off of the number of exams you've done. We charge a
Okay.
tiered pricing structure, starts at $55 per exam, goes down to 45, 35. So there's these 3 tiers of pricing. And
Okay.
based off your blended rate, it's in increments of 50 exams. So if you did 100 exams a month, the first 50 would be billed at 55. The next 50 would be billed at 45. Your blended rate would have been $50 per exam. And you know, if you're billing insurance patients, for the most part, it's a break even. You know, let's be clear.
Sure.
You know, IMED's paying $47 for the exam. So
Right.
that's just how it's going to work on the insurance side, but you're doing it for the optical volume of sales, you know.
Right. What about medical billing? Is that something that you guys get into or not really?
Yeah, it's a great question. Right now, we're just doing, like I said, the 2 main billable codes that we're doing. We're not doing continuity of care. If we identify something like a diabetic retinopathy, a glaucoma suspect, AMD, things like that, we're going to refer that to, if you have an on-site doctor who's doing exams, we're going to refer that back to your on-site doctor for a dilated exam, or we're going to refer it out to, you know, an ophthalmology or optometry group that's nearby that can manage the continuity of medical care for that patient, because we're not prescribing pharmaceutical drops. We're not prescribing any sort of treatment regimens like that aren't OT, you know, unless something was like OTC, but you know, something
Okay,
medical,
so
it's going to be
then-
a separate.
Right. So then something like an eye infection or something like that would not be something that would be outside the purview of this system.
Yeah, exactly. You wouldn't have the patient. We have a couple of hard stops, which is great. You know, great question, great point to bring up. It's that if you have a patient with, you know, who's had a surgery within the past 30 days, some sort of trauma, or you know, is under 8 years of age, those are 3 different hard stops that, like, we wouldn't even continue the exam if once we identified that this patient had LASIK 2 weeks ago. We're not doing a tele-optometry exam on that patient. There's just too much medical legal liability. Foreign bodies, things like that. You know, those are ocular emergencies, need to go to a
Sure.
live doctor, of course. So yeah, those are kind of the 3 main hard stops for which we would
Okay.
stop the exam, and hopefully you screen them out before someone comes in to see you for those types of things.
So then I'm trying to think of all the other questions. What about contact lens and contact lens fittings? Is that outside the purview of the system as well?
Depends on the state laws. So again, I have to kind of get more specific. I think in Missouri, we're fine for both new fits and refits. I have to go back and check a list and make sure that, you know, I'm not giving anyone, again, that's a more state specific thing that we put into the
Sure.
contract. And I check that against like my regulations when we're doing a contract stage. But yeah, generally speaking, we can do new contact lens fits, and we're using a digital slit lamp with video, which is really cool. We can see the lens slippage up and down on the screen. You know, so the doctors can correct like base curve fits and things like that for the patient. So we're able to do that with the digital slit lamp technology today.
Oh, and then I think I have one last question. If you, I guess, get the equipment through 2020 now, if I did have an in-person OD, could that OD use that equipment?
Yeah, of course. I mean, it's your equipment, right? You're purchasing the equipment, and
Okay,
again,
okay.
it begs the question in terms of individualized setups. So, for example, some of the digital phoropters allow the use of a doctor in the room to use the native controller it comes with. And when we're connected to it, we control it through the computer in the room and the specialized software we develop. Some of the phoropters do not, and so the doctor would have to use our software on a computer in the room. So again, depends very specifically on how you want to set up your practice, what's best for your group. With the situation you're talking about, I might recommend a NIDEC phoropter instead, because it allows that simultaneous control where the TopCon does not. So again, it's just there's these very specific variables that at some point we have to take it offline and have a very individualized conversation
That's
for your.
fine.
Yep.
Yeah, I want like you said, the broad picture, just kind of just trying to figure out this piece of my practice, really.
Yep. Yeah, no, it's, again, it's, so the short answer is yes. It's your equipment. Your doctors can use it when we're not present, for sure.
Great, thank you.
Hey, I appreciate all
Louis,
your questions for sure. Oh, go ahead, Brian.
I'm sorry, Bob. I was going to say, Louis, I just sent you an email with Bob's contact info. So if you got anything else specific, you can chat with him. Okay.
No, he went back on mute. Perfect.
Got
I
it.
know we had a couple more questions here. So,
I did want to jump in and say something I forgot to say earlier.
yeah, sure.
Unlike other scenarios, I think one of the biggest advantages to this is selling in the chair. This you are having a one-on-one with the patient for 45 minutes, however long, and it's something we've always asked the optometrists to do that they're resistant to, and I find that our sales percentage-wise is far greater with me and Brendan doing the exams than ODs.
No, it's great. It's a great point, Ed. And actually, I've shared that with a lot of customers. And I think a lot of our private practice optician owners share the same belief. And and they're spending more time. As a few of our customers are the ones doing the exam. Scott, I think we unmuted you now.
Yeah, I think it worked.
Hey, how you doing? Yeah, so I know you had a question about Florida. Did you have anything specific?
No, I just heard you mentioning the different legal aspects that could be going on. So really curious where Florida stood.
Yeah, so Florida is really pretty easy for us. It's interesting. Like Florida has a unique state law that says that essentially optometrists are supposed to be dilating on every eye exam, which even the optometrists aren't necessarily following. But ophthalmology can delegate, and so for that reason, our doctors are able to do an exam in Florida, a tele-optometry exam without dilation, of course, right? So other than that, that's really the only limitations in Florida, and we're covered through that as like an ophthalmology organization. So we have a number of customers throughout Florida, a lot of locations. Where are you located?
We're in Orlando.
Okay, great. Yeah, we actually have a couple customers right near Orlando. I don't know if you know Freedom Optical's out on Cocoa Beach. She's one of my original customers, and she's on our website as one of our positive endorsers. You could always go out and visit Stacy for an exam if you wanted to see what it looked like. But yeah, so we and we have a couple other customers actually right near Orlando area as well that are actually. Are you a Villavecchia member?
Yes.
Okay, there's actually a Villavecchia group right near you in oh, I'm drawing a blank. Brian, help me out. What's the group that we just set up verbally down there?
Oxford.
Oh, Oxford
Yeah.
Eyes. Yeah. Oxford Eyes in Orlando is one of our customers as well. So, if you wanted to go over there and get an exam, they're a very high-end group. And so if you wanted to go have an exam there, since you're right there, you could always pop in to see them or Stacy if you want to check it out.
Sure. Yeah, maybe.
Yep. So yeah, they are a Villavecchia member too. So good chat with you about that.
Cool.
Yeah, I don't know if did you have any other questions about Florida?
No, that was pretty much it.
Okay. Yeah, Florida's easy. So a lot of customers in Florida, and happy to get you set up down there.
Cool.
Great. Thank you. So I don't know. It doesn't look like we have any other questions. So we'll do a last round if anyone has any questions. And we have another one from Lewis. Sorry. Short answer is yes. Actually, you just answered about Illinois. Pam and her husband are on this call here actually with Blinka Optical. They're in Illinois, and we do have some in Missouri. So I'll get with you, Lewis. We'll connect, and I'll connect you to a closest location to get you in for a demo exam. I don't know. Here, hold on a second. Looks like he's trying to.
No, that sounds good. And honestly, like it doesn't necessarily have to be close. I'm willing to travel, mostly because I find in my market that not everyone's really helpful. It's pretty competitive, and so everyone's really kind of curious to keep their secrets rather than helping us as an industry succeed. So
Sometimes it's a little competitive.
So it doesn't have to be super close. I mean, and said I'm traveling to Colorado to the Opticians Association at the end of April. So, I mean, there's no market competition there. So I could probably get some really good feedback out there for that. So, so that's kind of the things that I'm kind of thinking about, or even Central Illinois would be another way if I can. But if there's someone in St. Louis, I'll be willing to talk to him too.
Yeah, actually, Fred just responded, said that he'd be happy to connect with you, and they're located in Illinois. And again, where are you located in Missouri? What city?
St. Louis.
St. Louis. Okay. Yeah. So let me go just check a map, and we'll connect, and I can tell you kind of the most common locations for you to go to.
That'd be great. Yeah.
I know that we have a location in St. Louis. I just have to reach out to the customer and see if they're.
Yeah. I mean, I can get them not wanting to say anything because I don't know if I'd show my hand either, but
I got you. Yeah, fair enough. Fair enough. No, but
Personally-
appreciate Fred and Pam offering an opportunity there.
Personally, I think the more that I want to show this to more opticians, I want the more that people are seeing this, the more opportunity they have, the more acceptance we'll have. We still meet with a little bit of resistance with some people who are afraid of of new technology. So I think the more the better.
Right. And, that's the interesting thing about this is, I come from a very old school model of training. And so the feedback that I've gotten when I propose this to peers in my field, or people that I would consider my peers, is like, nope, people want to see a doctor. And my thing has been, it's here already and people are using it. And I think we're just behind. And I got reinforced when I happened to be on Indeed about 6 months ago and saw that there was multiple ads for remote optometry in different states. And so, the big boys, your Luxotticas and your chains and what have you, they're doing it already, and they're getting a benefit out of being able to do this. And as an independent, I don't want to keep up with them. I want to do better than them. And I think this can show us in a much more technologically favorable light for sure.
You're thinking
One
about it the right
observation
way.
I had with this so far is that there's an age group that I found very interesting as the most resistant, and it's not the elderly. It's the people that are in their maybe late 30s, mid 40s that are the more resistant. People who are older through the pandemic, they were used to telemedicine. Yep. They're the ones that were seeing doctors on the time via their phones. So they're already used to this sort of concept.
Yeah, absolutely. Absolutely. Well, it's same for me with my multitude of health issues. It's like, well, call the video chat with the doctor. So it's here. I mean, it really is. I don't think that, I feel like as an optician, if you're an optician and you're not doing something like this, doesn't seem like you're doing yourself a service business practice wise.
Yeah, Louis, I think you're thinking about it the right way. And, certainly a lot of those ads you might see on Indeed are actually us recruiting for some of our corporate partners. Just full disclosure,
Sure.
It's a big portion of our business because they're investing in this. And when we are in a number of national retailers, nationwide, and it makes up the bulk of our business. But I think the private practice market really needs it as well. Even what's really interesting is even doctor-owned consolidations are starting to use this technology, are starting to bring us in. So, I mean, we've had multiple meetings with these large private equity groups that have bought up hundreds to thousands of doctor locations around the country. And they, even though they have tons of doctors under their own umbrella, they don't have them in the right places. And so even they need tele-optometry solutions for the satellites because they bought out a group for $1 million or $2 million. The doctor got that check and retired, and now they don't have coverage in those areas. So the tide has turned from even 3 years ago when I joined the company. It went from like why to how fast. So like 3 years ago, people were saying, why do we need this? And even during COVID, that's kind of what doctors were saying. And now when people call me, they're saying, how fast can you come in? How fast can you come in for an install? And I see Lacey, our customer success manager, and she does all of our new installs and trainings. She's actually joined the call, so she could come on and tell you the same thing because she organizes it. People say, how quick can you get in? And so it really is. It's been an interesting dynamic shift over the past few years because I think all the early retirements from COVID, largely from private optical spaces like Ed's doctors, they're retiring and now there's a huge void there. So depends on your market, depends on how backlog it is. It's really I've seen this question asked multiple times on opticians on Facebook. You know, what's the delays in your area? Some people say a couple days, 2 weeks, some people say 6 months. And so it just really, there's this huge disparity across the country, and not necessarily by city or by suburb. It's just seems to be certain places are really backed up. And so there's just a growing demand that's just going to continue to be there. So you're thinking out the right way. We'll connect you to an existing customer site so you can check it out. And I think you'll be pretty surprised that, you know, like Ed said, the age demographic, the seniors actually really like it. They just want their glasses now, you know, and the younger
Yeah.
people grew up. You did mention one thing I was going to say. You said people just want to see an eye doctor. Really important. They are seeing an eye doctor live in person, just like this. And in many ways, it's actually a more personable experience because nobody's masked up, right? And
Sure.
so it's, you know, there's something to be said for this experience today that a lot of people kind of prefer this experience. So I think you'll be surprised when you go and get the exam, and would love to have you check it out. So I don't know if there was another question. A constant vision. They were just throwing out some good words there. Appreciate that, of course. Always appreciate a positive endorsement. And yeah, I mean, if nobody else has any questions, I know we're on the hour mark. Appreciate everyone's time. You know, as you can see, there are always a lot of questions, a lot of interest, and I look forward to chatting with everybody. Feel free to reach out if you have any questions. Ed and Brian, appreciate your time and support as always. And
Thanks so much, Bob.
They can call me anytime. I'll be happy to talk to them.
If
sounds
anybody
like
needs Bob or Ed's contact info, please give us a call at the office. We'll connect you.
yep, and we'll be at Vision Expo East. If anyone wants to schedule a demo or come by, just stop on by the booth if you're going to be there.
Great. Thank you, guys.
See ya.
Thanks again, Ed. Bob, appreciate it.
Bye.
No problem.
Take
Have a good
care,
one.
everybody.